All right, we are going to get started. So this is everything you want to know about the COVID vaccine. My name is Dr. Valda Crowder. People call me affectionately Dr. V. Been an emergency medicine physician now for 30 years. And this is December 17th. We have a lot of articles and documentation, and that source material is at AskDrV.us. So if you go to that website, you can see the source material, and there will also be a recording of this presentation without the Q&A session. You can also follow me on AskDR_V. All right, so let's get going here. Feel free to take a picture of any of these slides as we go along. There's nothing here that's copywritten or anything like that. This is all for the general public. All right, so the structure of this webinar is a slide presentation, which has actually been a little bit closer to 20 minutes. 20 to 25 minutes with everything that's been going on with the webinar, then followed by Q&A. We're usually done by 9 o'clock. Everyone for this presentation is in listen mode. While the presentation is going on, you can actually submit your questions. You can submit them in the chat box, or you can submit them in the Q&A section. Either will work. I go back and forth between both. I deal with written questions first. All right. Now, the intention of the webinar is to keep people informed about COVID-19 science that will help them and their families stay safe during this pandemic and make the right choices for themselves. The outcome is that you're motivated to create or improve an action plan for yourself and your family, or you may be motivated to create or improve an action plan for a broader community. Maybe you have an office, maybe you are in charge of a school, or a union, or a homeowners association, or a church. All right, so I think it's often important, and I go through these slides at the very beginning because I want people to see how fast this has actually been going. It took us 98 days to get the first million cases, then 44 days to get the second million cases, 27 days to get to the third million case in July, 15 days to get to 4 million cases, 17 days to get to the 5th million case. Things then started to plateau just a bit, and we were running anywhere between 17 and 25 days. Then the fall started coming, 21 days to get to 8 million cases, 14 days to get to 9 million cases, 9 days to get to 10 million cases, 7 days to get to 11 million cases, 6 days to get to 12 million cases, and we have now gotten all the way down to 5 days. 5 days to go from 14 to 15 million cases. So that is 200,000 new COVID cases a day plus. So what happened today, and this happened this afternoon, right before this presentation, I think it came out around 6 o'clock, that the FDA endorsed the second COVID vaccine, which is the Moderna vaccine. We talked last week about the fact that we thought that this would get emergency approval. It has as of today. So starting tomorrow, you will begin seeing the Moderna vaccine begin to go out between tomorrow and the next day. Pfizer says they have millions of doses waiting, but the government hasn't told them where to go. I don't know, this is unfortunate, but, this is a huge distribution undertaking, and it requires significant local, federal, and state logistical support. Of course, as a result of the vaccine, we now have over 100,000 restaurants that have closed in the past 6 months. 40% of restaurant operators say they will not reopen. So it's unfortunate. I mean, I hope there is some sort of bailout for the restaurants. A lot of restaurants create the culture and the fabric of our communities. The other thing that happened today was the French president, Emmanuel Macron, became positive with COVID-19. He was described as having a fever, tired, and coughing. All right, a lot of people have asked me why I'm not flying, so I want to just go over why I'm not flying. This is just why Dr. V is not flying. You can decide what to do. I don't recommend it, but this is what I'm doing. Southwest Airlines actually was blocking the middle seat and began unblocking the middle seat as of November 30th. Now, what are the other airlines doing? Let's take a look. So if you look at who has masks available, Frontier Airlines, Spirit, and Sun Country do not have masks available. All of them have mask requirements. Not all of them clean their plane before every flight. Allegiant, Spirit, Sun Country do not clean their plane before every flight. Then if you look at the middle seat not being sold, Delta is the only one that has a long-term commitment to block the middle seat, and that is until March. Everyone else has either already unblocked the middle seat, they're selling the middle seat, or they intend to in the near future. So this is very important. Then you have people like this. You have a couple, and they knew they were COVID positive, and they flew to Hawaii. So in addition to people who are asymptomatic and do not know they're COVID positive, you also have people who know that they're COVID positive who are flying. Now, this was announced today, the 16th, actually, I'm sorry, yesterday. United Airlines began a contract tracing program with the CDC. Now, to begin. Now, this is another reason why I wasn't flying. I said from the very beginning back in March that the airlines needed to do contract tracing. They knew that they had stewardesses and stewards and pilots that were COVID positive, and they were not notifying the people that were flying, right? Similarly, if you were on the plane with a couple that I just showed, would the airlines call you and tell you? No. So United Airlines is the one airline that said they are going to begin now in the middle of December contract tracing. But prior to that, this was not in place at any airlines. And I have not heard anything about Delta, American, Spirit, JetBlue, or any of the other airlines putting together any sort of contract tracing program. So that's sort of that. All right, so state by state, there's a lot of moratoriums in place around not being able to shut off utilities. So in the purple states, there are moratoriums around not being able to shut off gas, electric, water, and also usually with that is evictions. In the red states, there are no moratoriums. So people can have their gas, electric, water shut off, and they can be evicted in the states that are red. You know, anytime there's a pandemic, you always have a hero pop up. This is a Florida man who paid off utilities for 114 family members that were at risk for having their utilities shut off in Florida. One of the things that is very, upsetting is that there've been more stealing of food and hygiene products. And it's upsetting because it actually really shows that, Americans are really struggling right now. It's unfortunate that we're seeing this degree of suffering. So let's talk about what we can do. So we know COVID-19 is highly contagious. You can catch it in under a minute, in 45 seconds. 60 to 80% of the people who get exposed to it actually get it, which is different than the flu, which is 30 to 40%. It's droplet and airborne. Droplets are large, 5 microns or bigger. They'd fall 3 feet or less from you. Airborne is less than 5 microns, and they go out further. So if you look at a diagram, this is kind of what COVID-19 would kind of look like, the red as well as the gray. So you can see how a mask could be extremely helpful in this situation. So how do I know if my family and I have COVID-19? There's 3 types of tests. There's a PCR, antigen, and a CT test, CAT scan. So PCR, that is the gold standard. You know you had it because it's extremely painful. It makes you go blink, 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 and makes you feel like somebody's almost like pulling brain tissue through your nose. It's very, very uncomfortable. I've had 2, unfortunately. And that was just as a screening before an elective procedure. The antigen test is a rapid test. Now, this is much more comfortable, but the issue is that it will tell you that you do not have COVID-19 30% of the time when you actually do. So that's what we call a false negative. The person really has COVID-19, but they're told that they do not. So if it's positive, it's true. If it's negative, you probably need another one. CAT scan also can actually diagnose COVID-19. If I blow this up here, you kind of see the white opacifications on the CAT scan. And they're very, very small, but they're not normally there. And that is the ground glass appearance bilaterally, and that's what it looks like to see a viral pneumonia. All right, let's see here. Let's get this back down. There you go. Now, COVID-19 has an odor. Dogs are very accurate at actually detecting COVID-19. It's interesting, I think that, again, this is something that we could deploy at airplanes, even in hospitals, to kind of separate out the COVID-19 patients from the non-COVID-19 patients. All right, we're going to talk about the 6 clusters. And I always tell people there's 7 clusters. One is completely asymptomatic, right? So asymptomatic people can actually transmit this disease. So cluster 1 is flu-like with no fever. Cluster 2 is flu-like with a fever. Cluster 3 is more like nausea, vomiting, diarrhea, abdominal pain. You may feel like you actually ate something that was stale or something along that line that doesn't quite agree with you. Cluster 4 is flu-like with fatigue. Cluster 5 is flu-like with confusion. And then cluster 6 is everything all together: abdominal, respiratory, confusion, fatigue, etc. So cluster 4, 5, and 6, I've highlighted them and underlined them because those are the symptoms that normally wind up having to go to the hospital. And those are the ones that wind up in the ICU, and those are the ones that also die. Whereas cluster 1, 2, and 3 are usually ones that can be taken care of at home. Now, I get a lot of questions about the flu and COVID-19. So there's a couple of very distinct differences. So 1, the flu is a respiratory disease. COVID-19 is a multi-system disease. COVID-19 impacts your lungs, your heart, your kidneys, your clotting systems. It impacts a lot of different things. So it is not just a respiratory disease. The flu impacts anywhere from 9 to 45 million people in a year. COVID-19 in 9 months has infected 16 million people in America. The issue is, and the big distinction is the death rate. So we have 61,000 people that normally die per year of the flu. We've had 308,000 people die in 9 months of COVID. So as you can see, it's about 5 times the number of deaths, and we have not yet gone through the entire year. Also, when people are over the flu, they're basically over the flu. When you're over COVID, you may not necessarily be over COVID. We have a lot of long-term disability associated with it. Right, so COVID-19 is very distinct. It is so contagious that we've had to shut down all elective procedures in hospitals. We've never had to do that before for the flu. 100% of the beds in the ICU in almost every hospital in America is COVID-19. There's never been a time when I've even known a single hospital to have 100% flu patients. As I said before, it's a multi-system disease that involves the heart, the lungs, the kidneys, the clotting system, etc. With COVID-19, we've had several people who have recovered and been dependent upon oxygen or even required a double lung transplant. Then additionally, with COVID-19, we have, in addition to people being in the ICU and on a ventilator, we've had patients where we could not even ventilate them on a ventilator. So we've had to put them on this thing called Ecmo. So I've gotten a couple questions afterwards. I think some of you might have some family members in the ICU, and they've been asking me, what is Ecmo? So I'm going to go over that a little bit later. So Keontae Johnson, as an example, he was somebody who had COVID-19 in the summertime, and he was playing basketball. He's a SEC basketball player of the year, and he's in college, so he's 19 years old or so, and he passed out on the court. They put him in a medically induced coma this week. Now remember, he had COVID-19 in June. Okay, so he was fully recovered from COVID-19. So this is what I mean by the sequela and the things that happen like months and years after COVID-19. So it's very, very interesting. So, all right, let's go over what to do if you found out that you're COVID-19. Quarantine for 14 days. preferably 21. If you do 14, I would recommend that you actually get tested so you know for sure that you're negative, and you get tested with a PCR test. It's very important to buy the thing on the right, which is the pulse ox. The thing that says SpO2, 97%, that is your oxygen saturation. Anything over 95%, if you're a young, healthy person, is normal, nothing to be concerned about. It's concerning when it goes less than 95%. Anyone who smokes or is older may start out with a lower pulse ox. You want to actually have zinc, vitamin D3. I think everybody should be taking those during this time period and keep those levels up in your body. You want to have access to a bathroom that's only used by you as well as your cell phone. Your cell phone is to call 911, not your family, because if you call your family, you're going to give them COVID-19. You want to have people leave food at a closed door, open the windows, and preferably, if you live with others, have a HEPA filter in your HVAC system. Now, let's talk about treatment. So I'm going to go over oxygenation, vitamin D, zinc, famotidine, Decadron, remdesivir, Regeneron, and Eli Lilly antibody cocktails. And I'm going to also talk about Ecmo. So oxygen is very simple. Vitamin D, zinc, everybody knows about. So let's start with famotidine. Famotidine is Pepsid AC. That is what this is. And this you use because it blocks inflammation. So people think of famotidine or Pepsid AC, you use it because your stomach is upset or to relieve acid indigestion or to relieve heartburn. But it also decreases inflammation in your body, and it has a lower combined deaths and intubation associated with COVID-19. Decadron is the steroid, also blocks inflammation, and it lowers the 28-day death rate for people that are on oxygen or on a ventilator. Remdesivir is an antiviral medication. It really has questionable benefit. Some hospitals are not even using it anymore. And some hospitals say, well, maybe it gets you off the ventilator a day or so earlier, but it really has questionable benefit. Regeneron is the name of the company. It is not the name of the medication. It is an antibody cocktail. So both Eli Lilly and Regeneron make an antibody cocktail. The Regeneron one is made from antibodies from a human that's recovered from COVID-19, as well as a second antibody that is from a mouse engineered to have a human-like immune system. And basically this blocks the spike protein. Eli Lilly's antibody treatment actually got approved November 10th. These antibody treatments, it's very important. They have to be given early. So if you wait too long, these may not actually be able to help you. So now let's talk about Ecmo. So Ecmo stands for extracorporeal membrane oxygenation. So extra for outside of the body, corporal body. Membrane is because it uses the membrane to oxygenate your blood. So basically what it does is it basically puts your lungs and your heart to sleep, and it takes over the circulation and the oxygenation with a machine that is outside of your body. So what does this look like? So they cannulate the areas of your heart to where all the blood comes in, and then where all the blood goes out. And then they actually run it through this machine, and this machine oxygenates your blood and then actually sends it back in. Okay. Now, what's important about this? This is a very, very serious thing to actually have done. You have to open up somebody's chest and basically cannulate their vein, their large vein and artery coming out of their heart, to actually put someone on an ECMO machine. This is done when you cannot ventilate a patient with the ventilator. So this is a very, very serious move to make. And normally a hospital, a major hospital, will maybe only have 6 or 7 ECMO machines. These are normally used for when you do bypass surgery or heart or lung transplants. All right, we know that the immunity wanes over time. There's 26% decline in COVID-19 antibodies over 3 months. This little lady here in Northwestchester actually caught COVID-19 twice. There have been other people who've caught COVID-19 twice. So this is why it's very important. Just try not to catch it at all. And we kind of get to the point where there's a vaccine. So now let's talk about vaccines and how vaccine trials work. So the vaccine trials are all what we call double-blinded, placebo-controlled trials. So what that means is the doctor doesn't know whether or not they gave the placebo or the test medication, and the patients don't know whether or not they received the placebo or the test medication. So this is done, and you go through the entire study, and then at the end of the study, what happens is you do what they call unblind the study. So the patients will still not know, but the physicians involved will then look at the data and they will know which patients got the medication and which patients got the placebo. So that's when they determine, well, what was the effectiveness of the medication versus the effectiveness of actually getting placebo. And so when the FDA actually meets to give emergency authorization, this is the data that they're actually looking at when they unblind, what we call unblind the study. So COVID-19 replicates in your body because it has a viral RNA, that is the actual virus, inside a fatty coating. The fatty coating has spike proteins on it. The spike protein has a receptor protein that it connects to. When it connects with that receptor protein, then that allows the virus to get into your cell. Once it gets into the cell, then it actually connects with RNA, and RNA, messenger RNA says, begin to make copies. And they make multiple copies of this virus inside of your own cell. So it uses the mechanisms of your own body to create more. Then it actually reformulates and heads back out again, and then infects another cell in your body. So that's essentially how it works. So old vaccine therapy, we would use weakened or dead viruses, right? And it would then train your body to think that it was something foreign. So if you think about polio, the flu, hepatitis A, yellow fever, that's how those vaccines were done. These vaccines are done a little bit differently. These are done with RNA. So people will say RNA. There's lots of different RNAs. I wanted to show you this table. We're not going to go over it. The one that's important is messenger RNA, or you may see it as mRNA. This specifically transfers genetic information from the genes to the ribosomes and tells it to actually make or synthesize proteins. So messenger RNA is like the thing that turns the copying machine on. So then it copies whatever protein it is. So basically the Moderna and the Pfizer vaccine use a messenger RNA approach, and it's coded for the spike protein. So what happens is when you get the vaccine, it doesn't give you COVID-19. It tells your body to make the spike protein, only that one piece of the outer coat. And then your body recognizes the spike protein as foreign and develops antibodies and attacks it and kills it. So when your body now sees COVID-19 in the real community, it will do the same thing. So the FDA gave the green light for the Pfizer vaccine last week. There's also then, as we said today, we got the Moderna vaccine approved for emergency authorization. So there's also the Johnson & Johnson vaccine, which is still in stage 3 clinical trials. So with that, they use the viral vector approach. So this is basically, they take adenovirus. Now, a lot of people say, what's adenovirus? Everybody knows what adenovirus is. Adenovirus is the common cold. It's the thing that you go to your doctor and you say, I need an antibiotic. And he says, I can't because it's a virus and it's not going to work. That's adenovirus. So they've altered adenovirus to be harmless, and then they've connected it with some genetic material from COVID-19. So the combination then teaches the body to generate antibodies and to actually attack the COVID-19 spike protein. So then it renders the virus harmless when you see it out in the regular community. So let's talk about doses, effectiveness, side effects, storage, peer-reviewed data. Pfizer, 2 doses, 92% effective. Side effects, soreness, fatigue, fevers, chills. We haven't really quite seen The percentages on any of this, so I don't have that because it has not been peer reviewed. It has to be stored at negative 75 degrees. So that's why you're seeing all the liquid nitrogen and all the talk about liquid nitrogen. So it has to be stored at negative 75 degrees. There were 4 experts during the FDA trial that voted no for authorizing COVID-19. Most of them objected to the fact that it was tested over 18 years old and they wanted to use it for those that were 16 and older. There was also some objections because they felt that the trial did not have enough minorities in it. Moderna, 2 doses, 95% effective. Same thing, muscle aches, severe fatigue, but it only requires cold storage, like negative 20 degrees, which is like your freezer. Also not peer reviewed yet, haven't seen the data to know exactly what the percentages are on the side effects. Moderna was found to be almost 100% effective in preventing severe COVID-19. The Moderna vaccine was also one of the ones that was one of its lead scientists, an African-American woman, Kizzmekia Corbett. So I've had a couple people email me and ask me about this. So I wanted you guys to actually see what she looked like, and that is her. She played an essential role in the development of the Moderna vaccine. Moderna vaccine showed that the chief medical officer, he said that it may stop people from getting sick, but it may not necessarily stop people from transmitting the virus. So this is important because even after being vaccinated, you still will need to wear a mask. Now, Johnson & Johnson, all we know is that it's 1 dose. We don't know anything else. We don't know effectiveness or anything else. I suspect we will see information about the Johnson & Johnson vaccine probably right around the beginning of the year, the end of the year, beginning of the year. Just a little bit about why vaccinated people will still need to wear a mask. A vaccine normally will stop you from getting the infection totally. This vaccine does not. These vaccines do not seem to be doing that. There may need to be more data about that. They prevent you from getting sick, but not necessarily transmitting the disease. Also, the vaccines that are 2 shots, you really do need to take the second shot. It would be a very big mistake for the CEO to only take 1 shot. There's another clinical trial that's getting ready to start. If anyone wants to actually join a clinical trial, Novavax is announcing a clinical trial that's going to start right after Christmas. And this is a biotech company that also has a COVID-19 virus, and it is derived from the spike protein as well. All right, a little bit about distribution. This was the National Academies. They put together a distribution framework that the CDC has adopted. And 1A people, which are 5% of the population, and they are frontline healthcare workers, nursing home, providers of home care, they will actually get, first responders, they will get the vaccine first. 1B is 10% of the population. That is people with comorbidities or risk factors. Phase 2 will actually be our healthcare, our teachers and childcare workers and child development workers. That's 30 to 35% of the population. Everything that you need to get your schools up and running, etc. Phase 3 is 40 to 45% of the population. That's people who are in forward-facing professions, think hotels, banks, exercise facilities, restaurants, etc. And then phase 4 is everyone else. If you look at what that is, that's 3 million people are long-term residents. They need 6 million doses. 20 million people are healthcare workers. They need 40 million doses. 80 million people are essential workers, and they need 160 million doses. So that's 200 million doses, 206 to be exact. And that's a lot of doses of this medication. They're looking at being able to get out possibly 1 million in a month or so. So we really do need more than 1 vaccine to actually choose from to really get everyone vaccinated as quickly as possible. All right, I get asked about air purifiers. If you want to get one that's ozone free in California, you have to. They filter down to a particular size of particles. 0.1 microns are those that are hospital grade. Some of them are noisy, some of them are not. So look at the decibels. Some of them have sleep modes. Some of them have indicators that tell you that you need a new filter. Then some of the filters are actually more than the air purifier. And then you've got to look at actually like how big of a room do they do. So I bought this little one. I bought it, a little small one, so that I could take it with me different places. It does tell me when it needs a new filter. The filters are not that expensive. The little holes at the top let me put in some aromatherapy. It's a little bit louder than I like, but it is hospital grade, and it was only $60. So I wasn't really willing to pay more for it to be quieter. I just figured I'll turn it off when it begins to annoy me. So, all right.